On today's podcast, we are going to talk to Savannah Dantzler. She is my daughter-in-law, and she is just getting ready to start in her surgical residency program at Lakeland Regional. We're going to talk about her time in undergraduate, med school, and what she thinks is going to be in front of her as a resident. We'll talk about the difference between being a medical doctor and a doctor of osteopathy, and we're going to talk about some of the things that she will be experiencing, whether she gets paid as a resident or not. We talk about her graduation. So I think you'll enjoy today's episode. We might even throw a little bit in there about fishing. So I hope you enjoyed today's episode on Todd's podcast. Hey, welcome back, everyone, to Todd's podcast. We have one of my favorite people of all time. She is our guest today. Her name is Savannah Dantzler. And Savannah's been in our lives for a number of years now. She is my daughter-in-law and married to my son, Jacob. And we're going to talk about her journey through medical school and getting into residency. I asked Savannah to come on because my niece, Liz Peak, she's married to one of our previous guests, Walker Peak. She thought it would be a good idea to have a conversation with Savannah and talk to her about her path to becoming a doctor, her education, sacrifice, hard times, good times, and some of the struggles that you go through as just a med student and everything. And now that she's going to be in the residency program at Lakeland Regional Medical Center, the general surgery program, did I say that correct?
Yeah, that's correct.
Yeah, but Liz thought it would be pretty cool to have you come on. You're on here reluctantly. I pulled a couple of chips off the table and said, I need you to come on. So I appreciate you doing this. And I'm looking forward to hearing what you have to say. I've heard some of the things. We've got some questions that some friends have wanted me to ask also. So we'll kind of go through there. So are you ready, Eli?
I was born ready.
You were born ready. You know, Eli is the most eligible bachelor in all of Polk County.
So I've heard.
So let's talk a little bit about your education. You went to Lake Region High School, but from there, where did you go? How did you get into med school, and what was your journey to do that?
Yeah. So I did. I was born and raised locally, went to Lake Region. After that, I kind of got a cross-country scholarship and went and ran cross-country at Saltwater State College, where I did my associates. Then I decided I kind of wanted to do exercise science, and then I quickly changed my mind to wanting to be a doctor. So I went and got my bachelor's in biology at Florida Gulf Coast, and then continued there. After taking the MCAT, I didn't do as well as I wanted to, so I went on to do my master's in medical sciences at USF, retook the MCAT, reapplied to medical school, and then I got into school over at LECOM in Bradenton. So.
And LECOM, there's an MD and a DO program, and what path does LECOM follow?
LECOM is a DO program.
And what's the difference between a DO and an MD?
So I think the biggest difference is a lot in like the way that we're trained. So a lot of MD programs, you do like the 4 years of medical school. DOs really just have extra coursework, and we do like hands-on training called osteopathic manipulative medicine that we have to do a lot of credits in, both like book work and practical work. And basically what osteopathic manipulative medicine is kind of like massage therapy and chiropractic stuff mixed together. So we have that extra training behind us, and we really focus on treating patients as a whole patient, and like the body, mind, and spirit are all one. So that's the biggest difference between MD and DO that I can really explain.
So an MD might just say, here's a prescription, this should alleviate this symptom or this pain, whereas do you try and find, or does an DO, do y'all try and find the root of it and say, hey, maybe it's not just a pill for taking care of it. Maybe your back's out of whack, or your knees are out, maybe your body's out of alignment, and maybe we can do this. That's kind of some of the stuff that y'all do.
Yeah, so we treat a little bit more holistically, right? We do still prescribe medications and everything, but we kind of treat the patient as a whole. We don't just treat the symptom that the patient comes in with. We take a step back and say, okay, there are other factors in your life that could be, affecting what's going on with you. If you're having pain, stress can contribute to that, or something else going on at home can contribute to your pain. And
Eli is the bane of my stress around here.
Oh, really?
Yes. 100% of it comes from Eli. So there may be young people who are listening or parents who are saying, you know, I think my daughter or my son's talked about wanting to be a physician. You know, what kind of went into the process? How did you go from manipulative, whatever your
medicine,
that to wanting to be a DO and become an actual doctor?
So the osteopathic manipulative medicine is incorporated in the DO degree.
Okay.
But if you're asking more so like my path into becoming a doctor.
That's exactly what I'm trying to inarticulately say.
Okay. So my path to becoming a doctor really, it's a little bit longer than some, but I basically had a few events in my life, medical events, family passing away and stuff, that I kind of determined like, hey, I want to do physical therapy. And then in going to school and then, you know, meeting my mentor and all of that, I was kind of pushed into, oh, there's actually a chance for me to be a doctor because, you know, we'll go over this a little bit later too. I don't come from a family of doctors, so I never thought that was really in the cards for me.
I don't either.
Yeah.
This was the first one in our family.
Yeah.
And now you're the second, so
Yep.
I feel we're on a roll now.
There. So I never really thought that was in the cards for me, so it was a little bit of a learning curve for sure. I felt like I kind of had to figure a lot of things out on my own. But after going through that, I applied to MD schools when I did apply initially, and I didn't get accepted to any of them. So I took the MCAT, didn't do well. So it took a few years for me to kind of say, okay, I learned the difference between MD and DO, felt like I aligned a lot more with the DO programs, and so I applied and I got accepted. So that's kind of how I found my path into that.
Yeah. Who were some of your mentors that kind of push you towards being a doc, whether it was before you got in or once you got into the internship program and now you're going into residency? Who have you kind of leaned on and say, I like how they practice, I want to pay attention to how they do it?
Yeah. So I was born and raised in Winter Haven, went to Lake Region. I kind of met my mentor, Dr. Honer. I know a lot of people might
Rick
know.
Honer in
Rick
Winter
Honer.
Haven. Yep.
Mm-hmm. So I met him through that. I obviously didn't know he was a doctor for a while. And I eventually...
He was your cross-country coach,
He was my
wasn't he?
cross-country
And
coach.
He didn't even tell you that he was
Nope,
a physician?
I did not know he was a doctor. He's very, very humble, and
Right.
he gives a lot back to
Yes,
the
he does.
community
Yes.
and to a lot of people. So he became my mentor, and we got to talking, and he took me on a mission trip to the Dominican Republic, and they were doing surgeries there, and I got to scrub in on surgeries and really be a big part of that. And I think that really changed my view into what I wanted to do. And from that point on, I really knew I wanted to do surgery. So I saw how it could change people's lives, and I really wanted to be a bigger part of that. So
Did he push you or help guide you or just say, open your mind to it and you kind of walk through? Or did he say, hey, Savannah, you can do this?
yeah, he really just...
I think he's been encouraging to you as well.
He's been very encouraging to
Yes.
me, and he didn't push me into being it. He gave me the confidence to know that I was able to do it. Because like I said before, my parents never limited me, as a child. They thought I could accomplish anything in the world.
Right.
But, your own confidence has limits, and knowing that my family didn't really push to, become doctors or anything like that, they still work incredibly hard, but I didn't have the confidence in me to push myself that far, and he kind of said, you can do it. So he kind of guided me and gave me some tips and tricks and really showed me what it was like so that I could feel comfortable in the environment, and gave me the confidence boost to kind of accomplish that.
I have never seen you with a lack of confidence. You're one of the bravest people that I know, and I mean that wholeheartedly, not just because you're my favorite daughter-in-law, but I mean that sincerely, and I've thought that for a while is, there wasn't a big safety net of 5 other doctors at home saying, hey, you can do this. If you can't do it, give me a call. I can help you with this exam. I mean, you kind of did this on your own with help. You weren't all by yourself, but that's something I've always admired in you. And there may be other students that don't have that support mechanism of either your family or a Dr. Honer or any of the other folks that have, tried to lift you up. Are there is there any way to help? Is that something you might want to do, is be a mentor to young women or young men who are wanting to get into physician business, the doctor business?
Yeah, I would love.
I know you got to become one. I know you're a doctor, but I know you got to
Yeah.
kind of get into the business before you can start mentoring. But
Well, even now, I have people reach out for me from undergrad or, friends of friends or whatever, and they'll ask me about getting into medicine, what it's like, and all the things. And I'm happy to help anybody that needs help with it, because anyone can do it. It just takes a lot of hard work, a lot of determination, a lot of passion and care. And if you have that and you want to do it, I'm happy to help you. I'm happy to answer any questions anyone has. But, people reach out to me already and ask me about that. But I went to, Lake Region had an alumni night, and I went over there and they mentioned kind of like maybe talking to their medical program. And that's something I'd really be interested in too, is talking to all the high school students and, kind of spreading the word about being a doctor.
and be a public speaker.
Maybe.
Yeah.
We're working on it.
How about Dr. Advani? I know she's been a mentor of yours, and she's not well known in the community, but I'm not going to say she's adopted you, but she's taken a keen interest in you and your career, and she's very proud of you as well. And I've seen that. But you need physicians, you need mentors like that to boost you up, to pump you up when you're kind of deflated a little bit and struggling. And
Yeah, Dr. Advani, she's amazing. Very, very busy woman. But she really advocates for women in medicine. She really has been an inspiration to me in really believing that women can become doctors and be great doctors that care a lot for their patients and pay attention to detail and are just very successful in the community. So she's given me a lot of hope, a lot of encouragement, and she's very passionate about her patients and her work. So that's definitely another mentor that I've kind of gathered along the way. I remember when she first started at Gessler Clinic, which is now Baycare, but yeah, so she's absolutely amazing, and she's been an incredible support to me too.
hey, everybody, if you're looking to purchase a new or pre-owned vehicle from a dealership that makes the process easy, straightforward, and actually enjoyable, you need to check out the Chevrolet Center in Winter Haven, Florida. Located at the corner of Cypress Gardens Boulevard and 1st Street, they've been family owned and operated since 1958, serving our community with top-notch customer satisfaction ever since. My family and I bought several vehicles from the Chevrolet Center, and I am confident they will earn your trust as well. Stop by and say hello to their friendly staff at 101 Cypress Gardens Boulevard in Winter Haven and tell them Todd's podcast sent you. What was med school like when you were there? What the intensity of it? Was it just pressure every day, or was it short burst of pressure and then, some periods of, okay, I can breathe a little bit so I can function and try and get through this?
Yeah, so medical school is very intense. It's very emotional, and I'm kind of glad I was a little oblivious before I started about the intensity of it. But yeah.
So no one told you couldn't do it?
No one told me I couldn't do it. They just said it's going to be hard, and I was like, okay, we'll see how hard it is. And so
that sounds like something Liz would have told you. It's going to be hard.
Yeah. She's like, brace yourself. Or she's like, have you thought of anything else you want to do in life? And I'm like, nope, this is it. But yeah, so medical school, first 2 years is a lot of book work, and then the second 2 years are clinicals. But for all physicians, really, MD and DO, you have book work in the first 2 years, but also like a lot of practicals that you have to study for. For DO, you're studying for more practicals because you're practicing OMM on top of that. So you have to, practice your techniques and all of that. But yeah, it's really intense, really emotional. I leaned a lot on my friends and a lot on my family to really help me through all of it, because it's emotional, and you can be doing your best and doing really well and still thinking you're not doing very well. So
yeah. It seems like a lot of you hear stories, you see TV shows during residency and during med school, the students, the physicians are just exhausted. Mm-hmm. Why do they work everyone to exhaustion? Because that, to me, leads to burnout of docs later on in life. And that's something that is a huge problem in the medical community, is docs getting burnt out. And, when they get burned out, that's when errors get made, or they start having less enthusiasm and, need to make other changes. And we can't afford to lose docs right now.
Yeah, that's a great point that you bring up, because I think physician burnout is starting to become more of a conversation.
Yes.
It's not being pushed under the rug as much anymore. I know for my medical school specifically, they talk a lot about physician burnout. We have some lectures on it and all of that, and they focus a lot on wellness and really having that work-life balance. And even into residency now, they're trying to work on laws for hours and all of that stuff. So,
but aren't you getting ready to do 6 days a week, 12 hours a day?
It's still a lot. I'm not saying it's not a lot.
When are these laws coming down? In 4 or 5 years when you're out?
We're capped out at 80 hours a week.
Okay.
So, but it used to be...
See how easy you have it around here, Eli?
Easy.
You and the girls in the Devil's Triangle are just skating through life, whereas Savannah's doing 80 hours minimum.
Yeah. But it used to be, they didn't have hour caps.
Right.
But there may be many reasons why they, quote unquote, work you to exhaustion. You have to know how to function when you're tired.
Right.
As a doctor. You have people's lives in your hands, whether you're doing surgery or anything else. It's important to be able to function in your sleep, basically.
What are some of your expectations of being a resident in the surgical program?
Exhaustion,
Okay.
and being worked really hard, and learning a lot, and just, having fun with it. So I think being a resident is very fruitful, but you're learning all of the basics of everything. So it's a lot of information that you have to learn. And with the amount of hours that you're there, you're exposed to more pathologies. And the more that you see, the better that you're going to be. So really, you're getting as much experience as you can.
So the general surgical residency is a 5-year program.
Correct.
And you're not just in the OR 12 hours a day. You're operating, then you're coming out, you're doing book learning, you're doing rounding.
Yeah.
How many doctors are in the residency program each year at Lakeland? Do you know? Or like in your class? Or
How many
whatever
residents they
Yes,
accept?
sorry.
Yeah, so different residencies accept different number of residents, but for general surgery specifically at Lakeland Regional, they accept 4 a year.
4? Mm-hmm. Okay. That's not many.
No, it's not.
That's not many.
No,
That's quite
it's
an
not.
honor. I mean, I think
Yeah.
it's a great program. It was fun watching your graduation a couple of Sundays ago. Mm-hmm. And your family was there. I got an extra ticket. You found me an extra ticket, so I got to go over with you and Jacob, which was fun. And I think y'all graduated about 180, 185 new physicians that are going out into the world. Do you ever pay attention to how many docs are really needed, or are you just so focused on, hey, I got to learn how to be a surgeon? I mean, are you looking at bigger picture, or are you kind of micro-focused on, I got to learn how to be the best Savannah I can be, and then I can worry about the other stuff later?
Well, we know that there is a doctor shortage, and that's common. A lot of people know that and can tell that there's a doctor shortage. But for me specifically, I know that that's a thing. And really in the community in Winter Haven, Polk County, there's going to be a surgeon shortage. So I've thought about that really a lot, but I kind of am really focused on what I'm doing because I need to be focused on what I'm doing right now.
Good. What's your robotic surgery? That's
Yeah.
kind of growing right now. What's your opinion of that? How is it? A robot doesn't take over. How does robotic surgery really work?
Yeah, so we talked about this a little bit earlier. It depends on what kind of robotic surgery you're talking about, whether you're talking about orthopedic surgery robots or general surgery robots. They're a little bit different, but I'll just touch really on general surgery robots. So I initially was against robotic surgery, but Dr. Advani does a lot of robotic surgery. A lot of surgeons are doing that now. I think it's a fantastic invention. I think it's something that's really advancing the surgical, family a lot. I think that it's better outcomes for patients, right? Because instead of cutting a patient open all the way and having to do surgery that way with longer healing times, longer hospital stays, and all of that. If you do robotic surgery, patients have less recovery time. They recover faster, recover better with less pain. And anytime you open a belly completely, you have increased risk for adhesions, complications, infections, all of that. So robots kind of minimize those complications. They don't completely eradicate them, but they minimize those complications because you're not making as big incisions.
So when your husband was 12 or 13, got appendicitis, and I remember his mom and I took him to the hospital, and Dr. Spire did the surgery laparoscopically, and there's 3 little incisions, maybe a half an inch each, and one of them was even in the belly button. I think the other was below the belly, and I don't really know. And when it was done, you can't hardly tell. I mean, unless you're really inspecting the stomach, where the incisions were. Was that kind of the first step into robotics when laparoscopic surgery? Is it kind of the same thing when you say you're not opening them all the way up, or is it something different? And again, it's whether you're operating on a knee or a hip versus the belly.
Yeah. So, well, specifically with belly surgeries, I can't speak to that, but it seems like, laparoscopic surgery would have led to the development of robotic surgery. And laparoscopic surgery, you basically have 2 long sticks that you're working with, so you don't have as much mobility. But that's kind of why the robot was invented, because you have more hand mobility inside the belly and all of that. So, I guess laparoscopic surgery could have led to the development of robotic surgery, but there are limitations to both.
But robotic surgery is not a robot doing it. It's still your hands running the instruments and everything, correct? I mean,
right.
Are your fingers attached to everything like Edward Scissorhands and you're doing this and everything manipulates, or
I know,
is it a little different than that?
I know people freak out when they hear robotic surgery and they're like, I don't want a robot inside of me. But yes, you hook up, you make port sites and hook up this big robot machine over your body. And then the doctor will scrub out after they make, the portholes. They'll scrub out and they'll go sit in, like, it's a Da Vinci, but it's a big machine, kind of like a video game. And you can see 3D inside of the belly, and you put your fingers into these little things and you're able to manipulate the hands of the robot. So the robot's not doing the surgery, the doctor's doing the surgery. But
you're in the doc's in a different room?
Nope, you're in the same room.
Okay, so they're there, and all the other nurses and anesthesiologists and all the support team is still there.
Correct.
It's just the doc is not over the body. Right. Inside the body, he's inside the body through the robot. Right,
but the doctor's still in the room communicating with, the scrub techs and everyone in the room, and you still have scrub techs that are scrubbed in to change out the different robot arms whenever you need different tools.
As a surgical resident, will you do what they call will you be on call at some point? Is it first year you start taking call, or, hey, we got to get a couple years in where, when do they kind of turn you loose to where you don't have someone holding your hand quite so much?
Yeah, so I will take call. Every program's a little bit different about how they work call, and I know they're still working on our schedules currently, so I will eventually have call, and it's on, depending on the rotation that you're on. But you definitely have call.
Todd's podcast is sponsored in part by Saunders Real Estate, your trusted partner in land and commercial real estate since 1996. With over 125 expert advisors located throughout the Southeast United States, the full-service brokerage specializes in a wide range of property types from farms and ranches to commercial buildings and development land. If you're looking to build your legacy with a confident investment, please visit SaundersRealEstate.com or call 877-518-5263 to connect with an advisor today. So each year of residency, is the level of oversight over you, is that level of oversight reduced? And do you start getting a little more autonomy because you have more skill level, you have more education, you have more experience?
Yeah, so each year, it really depends on your skill level and how comfortable the attending is with you. But ideally, the goal of the attending is by, depending on the program, year 3, 4, 5, you're kind of doing a lot of it on your own.
And the attending is the physician that is overseeing your training. Correct. And your progression through the program.
Correct.
Okay.
Yeah. So
Is it typically the same person the whole way through, or
no.
hey, first year residents you get Dr. Smith, and 2 and 3 you need Dr. Jones or anything like that?
No, it depends on the service that you're on.
Okay.
So if you're on like a trauma service, you have multiple attendings that you could be working with. Every day could be different. So you're always working with different doctors or attendings, as I should say.
That's a lot of different personalities you've got to understand and work with. And I think that's part of the education is I don't just have hard patients. Sometimes I have hard docs that
Absolutely.
are demanding for particular reasons.
Yeah.
And that's part of the education process.
Yeah, and you have to understand all of those different aspects of people too, not just working with patients, but different personalities of attendings and how they like things specifically, because everybody's very particular. But as you go on in residency, you kind of have less oversight,
Right.
but you always report to an attending. So you always have someone, double checking what you're doing, because you're not a full-fledged doctor yet. But ideally, it's a little bit less as you go on in years.
So your residency is, I think you said, scheduled for 5 years.
Correct.
Can that be shortened because you're really good, or can it be lengthened because you're not quite catching up with the rest of the class? Or is it, hey, at the end of 5 years, you either sink or swim? Do they pace you out as your learning abilities progress, I guess?
Yeah, that's a great question. I don't think that you can test out early.
Okay.
Basically, because you have a certain number. It doesn't matter what kind of residency you're doing. You can do internal medicine, family medicine, whatever. You have a certain number of types of patients that you have to see, types of cases that you have to see, and you have an hours that you have to work. So those requirements kind of keep that 5-year or 3-year, whatever your residency
Right.
is. They keep it consistent. You can't really leave early because you've completed everything and you're really smart. But if you're not super comfortable with everything by the end of your residency, you can do what's called a fellowship. And that's if you're not comfortable with a specific thing and you really
Procedure.
if you want to like practice that specifically,
You can practice on Eli all day long.
I think I'll pass on that.
We can take his appendix out this Friday night over here
Yeah.
on the deck.
Yeah, I think I got plans.
Oh, you too?
Yeah,
Oh, darn.
We'll get him liquored up.
Would have been fun.
We'll get him worked up.
But yeah, you can do a fellowship if you want to continue your education and learn something more specifically and get more proficient in it.
But you can do a fellowship as you go through life even and say, hey, I really want, you don't just have to do it during residency. Can you be 10 years in and say, I'm not doing enough of these procedures. I need to do a few more. And is that what a fellowship would be called? I don't quite understand that.
Can do, so a fellowship really is if you want to specialize in something.
Okay.
Right? So it's
All
like
right, I get it.
After residency, 1 to 3 years, you can say, I want to do colorectal or I want to do hepatobiliary. Then you go specialize in that and you work in that. If you want to learn a new technique or something like that, you can always do training. They have like training programs where you can train with someone who's really good at it. And then you can either be certified in it or just have that better knowledge.
Do they teach you the financial side of being a physician? Not how much you're going to make, but how to run a practice, or you got bills to pay. Do they say, hey, you should join a hospital, or you should join a clinic, or you should join this at least till you get going? Do they kind of teach you the financial, the business side of life, or is it we're just here to teach you medicine? You're on your own when you leave, and you've got to affiliate with either a hospital or a clinic or a surgical group?
Yeah. As far as I know, really all of the financial stuff I've learned has been in passing.
Okay.
We get a little financial stuff like how to pay back loans and everything like that, training or whatever in medical school. But as far as residency, I don't know of anything specifically that they teach you. And it seems to be kind of a general consensus. Like if you want to learn how to run a business and all of that, it's kind of on you.
Right.
I've asked some of my preceptors like, hey, how do you do this?
Especially what is a preceptor?
Preceptor. So when I did clinicals and I was working with other doctors, they're preceptors or attendings.
Okay.
So yeah, I just asked them, hey, how would you bill for that, or how would you do that? And you'll learn billing and everything passively, but building your own practice or something, that's something you have to learn, I think.
Okay. Did they teach you how to cope with pressure?
They don't teach you how to cope with pressure. They encourage you to kind of figure out what works best for you.
But they don't give you coping techniques. I mean, I think the military kind of teaches the soldiers, hey, this is how you sleep during war, that this is how you cope with this type of pressure. I'm surprised there's not something that might help alleviate some of the burnout if you have at least formally been trained on how do I deal with the pressure that I'm under.
Yeah, so I came in with not specifically just studying. I have things that I do in my free time that kind of help me decompress. But they, like I said, in medical school, we have a couple of lectures where they give us papers saying, hey, these are certain ways that you can, cope with pressure. If you need help, reach out to us. We have help for you. Okay. So in that way, I think that's how they're trying to mitigate physician burnout. They're really bringing it to attention. You can burn out, you will burn out. So here are ways to cope with it. And if you want basically more information or more help, reach out. Don't be afraid to reach out.
I'm glad they're starting to do that,
yeah.
Maybe more, and making it a something on the front of everybody's mind.
Right.
Is, don't shy away from it. Don't ignore it because it's a real thing. Mm-hmm. Because I just see some of the pressure that the physicians that I know and dealing with my mom and making decisions that are life or death. I make a decision, in my business, whether someone should buy a shopping center or not, or buy a piece of ground. Someone's probably not going to die from that. Yours are life and death, and people feeling good and feeling bad and recovering. So I think the pressure is more.
Yeah.
What surgeries have been your favorite so far that you either like doing or you like, hey, they're really hard, but I really like the outcome for the patient, and that it really gives them a leg back up on life?
Yeah. So I'm not going into orthopedic surgery, but I really did enjoy doing hip replacements, knee replacements, and seeing patients recover from that, because I live a pretty active lifestyle and I love to see people, have those surgeries and be able to be active without pain again. So I really enjoyed that. But I think it's going to be a little off here, but one of my most memorable surgeries is, we had a trauma patient at one point and we did an exploratory laparotomy where you basically cut them open, get in the belly, and we did a splenectomy. I think that was probably one of my favorites, and that's called a trauma exploratory laparotomy. So I think that's one of my favorite surgeries. But yeah, I do like seeing patients also recover from knee surgeries, hip surgeries, and stuff.
To bring my son back in a couple of years ago, he was cleaning a gun, and one of the pins in the gun lodged in his hand.
Yeah.
And he said, Dad, I'm at Bartow Regional. Savannah's down here with me. And I said, what's going on? He said, I was doing something and a spring went off and stuck a pin in his hand. And I said, well, why didn't you just pull it out?
Yeah.
And he said, well, Savannah said, there might be some nerves attached to it. So that is one of the many times I've been thankful that you were with Jacob to kind of help him through, because otherwise he would have probably grabbed a pair of needle nose pliers and just jerked it out and put a Band-Aid on it. And you might have saved, just by knowing, hey, let's get someone who knows what they're doing, that there might be bigger. And he ended up having surgery. And, he was out for a few days because he uses his hands for a living.
He's a mechanic.
Right.
And, the nerve there, it's the recurrent median nerve really in the palm of your hand. And it supplies muscles. Right. And if he were to damage that, he may not be able to move his thumb well, be able to do his job.
Right.
We need him to do his job.
Yeah, but I just know that if I was with him, I said, why didn't you just get a pair of needle nose and pull it out?
We tried, and I was like, this is too close. I don't like it. Let's go to the emergency room.
So I've got a couple of questions from your husband, Jacob.
Oh, goodness.
And he's always a very active participant or so. He's a very good listener to this show.
He listens to all your podcasts.
I know it, and I hope that rubs off on you a little bit, but we'll get there. He wants to know how many dogs you have and which one is your favorite. And these kind of go to how you blow off steam and how you relax and deal with pressure. So
spending time with family and everything.
Yeah.
And our crazy dogs. We have 2 dogs. They're both rescues. One of them is about 10, 11 years old, and the other one's 2.
Your 2-year-old is a psycho.
She's crazy. I don't have favorites. I love them both so much for many different reasons. But yeah, I love them both. I can't pick between either one of them. One is calm, cool, collected. I love to cuddle with her.
Spinelli.
Yep.
She's very easy to be
But
around.
Maple, I could go run with her for a few miles, bring her home. 30 minutes later, she's like, okay, let's go again. She's just got so much energy.
Maple could be renamed Charles Manson, I think, if necessary. It's crazy to do. Do you like to fish? I know he likes to fish. Are you enjoy it? Do you like saltwater or freshwater? What's your preference?
I like saltwater better. I know Jacob loves bass fishing. My husband, he loves bass fishing a lot. He started doing tournaments again, but no, I love saltwater fishing.
The fish just taste better.
And you never know what you're gonna catch.
Right.
That's the fun of it.
If you weren't going to be a surgeon, would you want to be a boat captain? Do you like it that much?
I really do enjoy it a lot, actually.
Would he be the first mate? You be the captain, or would you let him be?
I would be the captain.
You would be the.
I'm the captain now.
I think you would. I've noticed that. I think that's a good choice. What's the most memorable fish you've landed? Have you ever caught something significant?
I honestly have not been deep sea fishing. I've caught a bunch of cool fish. I think the coolest one I ever caught was like an eastern sea robin. It's got like little wings.
Was that a bird?
No, it kind of looks like a bird.
Eastern sea robin with wings?
Yeah, it looks like it has little wings.
Is it a ladyfish or a flying fish?
I don't think it flies. It's not like a flying fish like you're thinking, no. But that's probably one of the coolest. I don't necessarily have a most memorable one. I caught my first snook a few years ago with Jacob. That was really cool. And this past time we went to Marco a few weeks ago, I caught a nice jack, and I'd never caught a jack before, so that was fun. That was a good fight.
Yeah. I also met a little girl named Dallas. She really looks up to you.
Oh.
She is a little cutie pie. She wanted me to ask you do you have a boat?
Oh my goodness. Yes, we have a boat.
What's your dream boat? Is what you have now, is it a dream boat, or is it like, hey, this is an entry-level boat and we're going to move on as, life gets better for us?
Yeah, well, Jacob has a dream boat.
Yes, but you're the captain.
Yeah.
We've
I mean, he wants a big
established that you're in
yellowfin.
Yes.
I don't have a dream boat necessarily. I know he wants a big yellowfin, and I just want to go out and fish. I don't really.
The boat doesn't matter.
The boat
just so long as
doesn't
you can
matter.
bring fish in.
Yeah, and as long as I don't capsize.
Well, it was funny, after Dallas asked me that question, she then said, hey, can I have $1? So that little booger is in teaming up with some of my other nieces and say, hey, I'm becoming an ATM for them.
Yeah,
so
she's
it's
learning
kind
the
of,
ways.
Yes, she is. She's very expensive for me to be around. Hey, everybody, this is your host, Todd Dantzler. As most of you know, I'm a partner with Saunders Real Estate and have been a very active and working broker for over 42 years. I have fostered strong relationships throughout the state of Florida, working on properties ranging from agriculture and development land to multifamily, commercial, and industrial projects. If you have any real estate needs at all, please give me a call. I'd love to help. My direct line is 863-877-2846. Thank you. You got married during your residency.
Yeah.
And
Medical school.
Medical school, sorry. And I remember the day of your wedding and the days leading up to that, you were trying to do testing or something, all while trying to help plan a wedding and be a calming voice, because everyone wants the bride to have the wedding that they want. A lot of stress, but it turned out to be an absolutely beautiful wedding and everything went well. But I'm thinking, here she is, she's still calm. You might have been like a duck swimming like a mofo underneath the water with your feet, but on top you were still there, and you just kept your cool through the whole thing. And that always impressed me, is this thing's going to happen no matter what. It may or may not be perfect, but it was a perfect wedding in my eyes and in many other people's eyes. You got married, you both said I do, and it was a beautiful ceremony. We had a great party, and we won't talk about Justin or Hannah that night, but we all had a fun time.
Oh, yeah, they were definitely a dynamic duo that night.
Has it been difficult to be a newlywed while this is going on? I mean, I know y'all dated for a long time, but all of a sudden there's all this pressure, and I've got these commitments I've got to make, and you're trying to balance going to med school, being a newlywed.
Yeah, so we have been together for a long time, and we were living together and all of that.
What?
And what? I'm shocked. Anyway.
Appalled.
Yeah, so it didn't really change anything to be married, but planning a wedding and doing all of that, I think I had an exam like the day before or 2 days before
I think the day
the
before.
wedding. Yeah, I'm pretty sure it was the day before I
Yes,
had a
we were
big
trying to
exam.
get you back for the rehearsal dinner. I know
Yeah.
that was kind of stressful.
But it was perfect for me. It was definitely a fairy tale wedding, and it was beautiful. And at
Yep.
the end of the day, there were things that went wrong that I'm sure nobody noticed but me. But we said I do, and we meant it, and we're living our dream now. So
Yeah.
that's the biggest thing. But it I don't think the commitments are really any more than what they were before. It was nice to get married in medical school. A little hard to change my name, but
Yeah.
I'm glad I did it then and not now.
It was kind of neat meeting some of your the friends that were in medical school
Yeah.
with you, and then I got to
Yeah.
see a couple of them at your graduation a couple of weeks
Yeah.
ago. And who was the guy that gave me the ticket? Mike?
Nick.
Nick. I'm going to tell you, folks, this guy's got the prettiest baby
Yeah,
I have
she's
ever seen.
beautiful.
And her name is Ellen.
Alice.
Alice. This is the prettiest little baby.
She's beautiful, and she's so sweet.
And she was. It was just so fun watching her, and it was a big day for their family as well, for Nick and his wife and family. So during all your schooling and all this life, obviously Jacob's had to do cooking and some other things. Is he a good cook?
He is a good cook.
What do you like for him to cook you?
He does make really good chicken Alfredo. I think that's probably the best thing that he cooks.
He likes smoking meat.
He loves smoking meat, so
He's good with
he
protein.
does make good pulled pork.
Yep. Mm-hmm. Is that your favorite meal, is the chicken Alfredo?
Probably. I do like his pulled pork. It's really good.
What do you like to cook? Or do you like to cook? Or you say, hey, Jacob, I'm in charge. I'm the captain.
I like to cook different things. Sometimes you eat the same thing all the time, and whenever he's like, oh, can you cook? Or I'll be like, oh, yeah, I have time. I can cook tonight. I'll think of something different. I've tried to make French onion soup, from scratch, or you eat chicken the same way all the time, so
Right.
I'll try to make something different with chicken, like the Marry Me chicken or something like that. So I look for different recipes all the time. We've been really big on Mississippi pot roast lately.
That's idiot proof.
Oh my gosh,
It
but
is
it's
so good.
so good. It's so
It is so
good.
good. Yeah, Bridget here, that used to work for us, she told me about it, and I said, that doesn't sound very hard. And that's like a pot roast and a stick of butter
Yeah.
and some French onion soup or
Yep.
some type of onion soup mix. And
Yeah, it's really
8 hours later, you have something to eat.
The funny thing about Jacob, though, is if he has a recipe, he will follow it to the T. And then when I cook, he can't even be in the kitchen because I use it as a guide, not as a...
Have we left anything off? Is there anything you want to talk about as far as, what did I not bring up about, because I don't live in the world of doctors like
Yeah.
you are either. Did we leave anything off that, hey, I really wish you would ask me about this or that? I
don't-
want to talk about this.
Yeah, I don't really have any specific questions that I think that you missed, but I think it's really important to touch on the fact that wherever you come from, whatever background you come from, you can do it, You may feel like you're not smart enough. I didn't feel like I was smart enough. I still don't feel like I'm smart enough. But if you work hard and it's something that you're very passionate about, I think you should go for it. Don't limit yourself and don't settle for something that doesn't make you happy. I was grateful to have a great support system, and I married into an amazing support system. So I do have that background, but, find whatever really pushes you to be your best and do it. And it doesn't matter. You don't have to be a doctor. You don't have to go to school, but do something you love. Do whatever you love for work. Like, don't make it a job. I think that's the biggest thing that I would like to leave off with.
Do you want to be an example for young women?
Yeah, absolutely.
Like Dr. Advani has been for you?
Yeah. And I never thought, as a little kid, I never thought, oh, I want to empower women to do the most that they can with their life. But here I am, and that's like the biggest message I could give to women specifically, but anyone, just...
And again, not coming from a world of doctors.
No.
You're the first one in your family,
Yeah.
and second one in ours now. Mm-hmm. And, I think the first time you do something different from the rest of the family, they want to support you. Just tell us how to do it, and we'll help you. But if we don't know that background, it's sometimes difficult.
Communication is very important, but, just it's going to be hard. It's going to be scary. Take the scary steps. Do the hard things because it's going to pay off.
Yeah.
And, you know, when you're on your deathbed, you'll look back and say, I did all of this with my life. I accomplished this. And instead of saying, I wish I would have done that. So.
Well, that's why I said earlier that you're very brave and you've got a lot of courage. And, you know, it's so impressive to see how you just kind of push through and all that. And I meant that from the bottom of my heart. One question I didn't ask you that I think people do want to know, do you get paid as a resident? Is that a paid job? Do you get paid for the next 5 years? Or is it like, oh, gosh, I'm just, you know, I'm living out of a can of tuna fish and ramen noodles or...
Yes, I finally get paid.
Okay.
My first paycheck is July 2nd.
Okay.
And Jacob cannot wait.
Is it going to buy him a yellowfin or not?
No, not quite. You don't get paid as much as an attending, but
right.
I will finally get paid. I have taken out a lot of student loans to get me to where I am, and felt like I've kind of worked for free a lot, especially during the clinical years, but it's all to learn.
Right.
And so it'll be really nice to have a paycheck and have a double income finally.
Do you make more each year being a resident? Do they give you a raise every year, or are you like, hey, if you make $1 this year for 5 years, you're just going to make $1, or hey, make $1 and a nickel the second year and $1 and a dime the third year?
Yeah, the more you progress, you know, the more responsibility you have in residency.
Okay.
So you get paid a little bit more each year. Mm-hmm.
So it does help you with your medical bills that not your medical bills, your student loan bills, you know, for med school and all that.
Yeah, I can finally start paying them back.
Good. I'm sure whoever's loaned you that money will appreciate that.
They're sweating, I'm sure.
Well, I want to thank you for coming in and telling us a little bit about your life as a med student and what your expectations and kind of, you don't really know everything to expect yet for residency, but you kind of have your head on your shoulders and you're going into it with a great attitude, I think, and we're looking forward to see you as you progress. And maybe if we're still on the air, Eli, in 5 years, we can have Savannah come on and talk about what it's like to be a surgical resident,
as
opposed to a med student. Was it a good experience for you today?
Yeah, it was a great experience.
You were a little nervous about it.
I was very nervous.
I've never known you shy to be shy to talk, but you've done well.
Yeah.
But there is one thing I want to close with, is at your graduation a couple of weeks ago, I kind of glanced at your mom and dad. And that was really cool. And I got to see the smile on your dad. And I think I counted more teeth in his mouth that day than any other day, because his smile was bigger than I've ever seen it. And they were bursting with pride, and your grandparents and all of us there. It was just really cool to see that, and to see that pride that, you know, parents have in their student and their child, and just like I have in both of my children, and just like your mom and dad have in you and Justin, and it was just really cool, and I was very thankful to get to be part of that. So thank you, Nick, for coughing up the ticket.
Yeah.
And thank you, Alice, for being so cute that day. You were the hit of all the pictures of the family, but it was a really neat day. So I'm looking forward to see you continue on as your life as a doctor develops and as it evolves, and we'd love to have you back on. Yeah,
thank you so much for having me and just for supporting me for so long. And, you know, you've been incredibly supportive. I couldn't have, you know, wished for a better father-in-law, because this road is very hard, and family is very important. And it's hard to do alone. Oh, yeah, it is very hard to do alone. And as much as you want to or think that you can, it's impossible. Yeah. But, family support. Get help whenever it's offered. Yeah, get help whenever it's offered. That's a big thing that I've learned, definitely being a part of this family too, is, you know, it's okay that you can't do it on your own, and people are willing to help you. Yeah. And that's okay to ask for help. Yeah. But I'm very grateful for your support and for your love and generosity. And my family too. Yeah, they're very, very proud. Yeah, they are. Put a lot into it too. Yeah, it's fun to get everybody together. Yeah. So thank you for coming on. I appreciate it. Eli, thank you once again for being an engineer extraordinaire. And I hope that you folks enjoyed today's show. It's a little different than some of the things we've done before, but hopefully you'll enjoy, you know, kind of getting some insight of what it's like. You may have a child that's thinking about it. You may be listening and thinking about it, or, you know, a family friend
But Savannah's been a great example of this, and I appreciate Dr. Honer, Dr. Advani, and all the other physicians that have kind of, been that mentor, mentee program with you, and how they've helped develop that. It's been a great show. Thank you all for listening. We look forward to joining us next time. And as always, I want to encourage you to subscribe or follow. It is free. And if you don't know how, go to Amazon Music, YouTube, Spotify, or Apple Podcasts. They get all those right.
That's all right.
First time in 76 episodes, I've got it without a whole lot of coaching and stinky eye from Eli over in the corner. But it's important. It's important for us, just to have as many followers as possible. We look forward to it. And
if you subscribe, you become one of the first people to get notified when we release an episode.
And they come out every other Tuesday morning.
About 5 a.m.
Yeah, that's when I get mine. And I hope you enjoyed this episode, and we got some other neat ones coming up. So look forward to talking to you next time on Todd's Podcast. Thank you for listening to Todd's Podcast. This has been your host, Todd Dantzler. If you enjoyed today's episode, please don't forget to rate, review, follow, and subscribe to Todd's Podcast on your favorite podcast app. If you have any questions for me, suggestions for future guests, or are interested in sponsorship opportunities for our podcast, please just fill out the contact form on my website, todddantzler.com. I look forward to hearing your questions and feedback, and please take care.